Good day everyone, I'm Junce Metante from BSN 1A17. So for today, I'm going to perform a return demonstration on the assessment of the cardiovascular system. Okay, so prior to performing the procedure, I'm going to of course perform proper hand hygiene to deter the spread of microorganisms and to prevent cross-contamination. After that, we can now proceed with the assessment. Okay, good day. I am Junce and I will be your student nurse for today. Can you please state your name
I'm Junce Metante.
and your date of birth?
I was born in May 4, 2004.
Okay. So that would be the first step. You have to verify the patient's identity to ensure that you have the correct patient in front of you. And if there are any curtains or doors, you have to close it to provide patient privacy. After that, you can now proceed in explaining the procedures and its purposes to the patient. So how do you want me to call you?
Just call me Jan.
Okay, John. So for today, I'm going to conduct a cardiac examination, and in doing that, I'm going to do inspection, palpation, percussion, and auscultation. This is important because for me to ensure that everything is normal, and if there are any abnormalities, I'm going to take note of it to prevent any further complications. So do you have any questions before we begin?
No.
Okay, but if you do have, you can just ask me throughout the assessment. So first things first, I'm going to examine the carotid arteries. So the first thing I'll be doing is I'm going to auscultate for bruits, and then I'm going to palpate or feel the carotid artery, taking note of its contour and amplitude, and then grade it. Then after that, I'm going to assess the neck vessels. I'm looking for bulging and any fluid overload, things like that. Okay, so let's get started. First, we're going to auscultate the carotid artery. And what we're listening for are bruits, or the blowing or swishing sound where you have turbulence of blood flow. This is indicative of atherosclerosis narrowing. In doing this, we are going to use the Bell stethoscope and listen in 3 different places: at the angle of the jaw, mid-cervical area, and base of the neck. The key whenever you're doing this is you want to press lightly with stethoscope's bell to prevent hearing a false bruit or compromising circulation. And what you want to do whenever you do this, you want to have the patient take a deep breath and have them exhale and hold it for a second while you're listening, so you're not hearing breath sounds and it won't mess with the sounds you're hearing. Okay, so let's listen first at the angle of the jaw. John, can you please take a deep breath and exhale? Then in the mid-cervical area. Take a deep breath, then exhale. Okay, again. Okay, that sounded great. And then you're just going to compare sides and repeat on the other side. You always have to remember to do not palpate the carotid artery if you hear bruits upon auscultation, because bruits can be critical finding and is suggestive to carotid stenosis and partial obstruction of the artery. Now let's palpate the carotid artery. Whenever you're doing this, you're going to compare sides. So you are going to palpate lightly and use your index and middle finger, not the thumb. Also, avoid putting too much pressure on the carotid sinus because this has sensitive baroreceptors, and especially in the older patients, you can cause a vagal stimulation which will slow the heart rate down, so do not do that. It's generally good to palpate in the lower half of the neck to avoid the carotid sinus area. Okay, so you are not going to palpate it together, so you're going to do it one at a time. Okay, so you are actually feeling for is the amplitude and the contour. You want it to feel smooth and rapid and have a rapid upstroke and slower downstroke than graded. A normal grading is 2 plus if it's really hard, and bounding it would be 3 or 4, and if you can barely feel it, it's diminished. Moving forward, I'm now going to assess the neck vessels, particularly paying attention to those jugular veins. I'm looking for increased central venous pressure, and in doing that, I'm going to have my patient lay back supine at 45-degree angle, and then I'm going to turn the neck to the left side for me to observe in the right side. Okay, so it is helpful also to use extra light to shine in the neck to see the vessels clearly. What we're going to look for is the sternomastoid muscle, which runs right here. And we're looking for the external jugular, which overlays this muscle. And normally what you will see is that it's slightly flat. Again, you might need your light, or you may not even see anything at all, which is okay. And if you do see that this is bulging or very, very large, this is usually present in patients with congestive heart failure who have increased central venous pressure. But here in my patient, it's nice and flat, and you want it to look like that. Now that I'm done examining the carotid arteries and the neck vessels, I'm now going to examine the precordium and the cardiac functions. Okay, so first thing, I'm going to inspect the precordium. I'm going to look for ventricular pulsation, contour, and hues. Okay, and I also am going to observe the apical impulse, which is located in the 4th and 5th intercostal space. So in this case, I don't see it pulsating. Okay, so now let's move on to palpation of the precordium. And in palpating, I'm going to use the pads of my fingers in palpating for pulsation. Okay, so I'm going to palpate on various spots systematically. Beginning at the right sternal border, at the 2nd intercostal space, and then moving on to the left sternal border in the 2nd intercostal space, and then going down to the 3rd, and then to the 4th, and to the 5th. You are going to feel for any thrills, hips, or lifts, which these are pulsations that will lift the fingers up. Okay, you're also going to palpate for the point of maximal impulse, which is located in the 5th intercostal space in the mid-clavicular line. You should feel pulsation of the ventricular pulsation in the point of maximal impulse. But if you don't feel the pulsation, you have to roll the patient to the left side to bring the impulse down a little bit. Okay, so after palpation, we are now going to do auscultation. So in doing that, I am going to use stethoscope. I'm going to use both the bell and the diaphragm, but I'm going to start in the diaphragm. Start listening in the diaphragm and then following the bell. Okay, so I'm going to listen in various spots, similar in the area that I palpated, and okay. Starting in the aortic area, then pulmonic area, to the 3rd, 4th, then 5th, then to the point of maximal impulse. Okay, so what you are trying to listen is for in the presence of murmurs, and for the normal sounds, which is S1 and S2, and for the extra sound, which is S3 and S4. Okay. Good. You also have to take note of the heart rate and the rhythm. Okay, so that concludes the cardiac exam, and I'm now going to perform hand hygiene and then document the findings. And if there are any abnormalities, I'm going to refer it to other healthcare providers for further evaluation. So that would be all. Thank you.